Hi, my dear students. Now we are going to discuss about fontanel, types of fontanel, and sutures of fetal skull. So in this, you can see. So this diamond shape. Okay. This diamond shape structure called anterior fontanel, and this triangular shape structure called posterior fontanel. Actually, what is fontanel? Fontanel is nothing but it is a wide gap between the suture or an ossified membrane or soft spot membrane. Generally, it lies between the cranial bones of the skull of a fetus or infant. So, generally, there are four minor fontanelle and two major fontanelles are present. So, now what you are seeing, these two are major fontanelles, anterior and posterior, and remaining fontanelles are two anterior lateral and two posterior lateral fontanelles are present. And so, this one called coronal suture, and this one called sagittal suture. So this one called sagittal suture. So clearly I tell you now. So this one is called coronal suture, and this line is called sagittal suture, and this called metopic suture or frontal suture. This anterior fontanelle present between coronal suture, sagittal suture, and metopic suture. And this posterior fontanelle present between sagittal suture, lambdoid suture. And do you know this anterior fontanelle when it closes? When it closes, this anterior fontanelle closes at the age of 12 to 18 months after birth. Okay, and this posterior fontanelle closes at the age of 6 to 8 weeks of extrauterine life. And this anterior fontanelle also called bregma. This posterior structure also called lambda, right? Then the meeting point of sagittal suture, lambdoid suture called lambda, and the meeting point of sagittal suture, coronal suture, and frontal suture or metopic suture called bregma.